My name is Ruth Schofield, and I'm Assistant Clinical Professor at McMaster University and co-chair of this CASN Climate-Driven Infectious Disease Advisory Committee. I am happy to welcome all of you to this first session of the CASN Climate Change and Nursing webinar series. This webinar series aims to support the dialogue on the important topic of climate change and nursing, and in particularly related to vector-borne infectious diseases. Before we begin, I'd like to take a moment to respectfully acknowledge that CASN's national office is located on the traditional unceded territory of Algonquin people. I would also like to go over a couple of housekeeping items, and please note that today's session will be recorded. The recording will be posted on CASN's site and shared through CASN's networks as part of the dissemination strategy for this project. And also, before we begin, if you have more than one person with you, if you could just put in the chat box how many people are actually with you, if it's a shared time to participate. So today's session will begin with a presentation from our speakers, and we'll conclude with about 20 minutes of Q&A. After the presentation, we will take questions. You may be able to do this through the chat function on your screen, so feel free to add questions through the presentation. Alternately, you are welcome to unmute your microphone to ask questions directly to these speakers. We ask that everyone mute their microphone if you're not speaking. So while we have our presentation, if you could mute, and also during the Q&A, if you could mute it while you're not speaking, just to ensure that we have adequate band. So in today's session, so we'll move forward now, we will hear from Morgan Magnuson and Shannon Vandenberg. Morgan and Shannon are both nurse educators in the Faculty of Health Science at the University of Lethbridge, located in Lethbridge, Alberta. Their background is in public health nursing and have enabled them to bring public health issues such as climate change, infectious disease spread, and communicable disease control into the course they teach, helping students to gain a practice understanding of relevant issues in Canada and around the globe. And this background has enabled them to do this in public health. We also are able to hear from Michael Foley, who is the web designer of this e-resource and founding partner of the technology company Pixera, member 365 and SavvySail. Holding a deep understanding of database development and web design and interactive media, Michael has been involved in many aspects of the information technology over the past 25 years, so clearly brings a strong experience in web design. Today, Shannon, Morgan, and Michael will share information on CASN's soon-to-be released climate-driven vector-borne disease and nursing e-resource. The focus of today's session will be on Module 1. To hear more about this work, before I say that, this will support, if you're not aware, of the guidelines that already exist on CASN's website on climate-driven infectious disease and how we can integrate it into nursing curriculum. So I'm going to turn this over to Morgan and Shannon so they can begin. Welcome, Morgan and Shannon.
Thank you, Ruth. So I'm going to begin and just talk a little bit about the project. As Ruth already mentioned, the focus of today's session is talking about climate change and nursing. And today we're going to talk a little bit about the project overview, the e-resource structure and design, a little bit about what Module 1 looks like, and then how you might want to integrate this into your courses. The Canadian Association of Schools of Nursing gratefully acknowledges the expertise, time, and contributions of all those who have engaged in this project for the development of the education guidelines and now the accompanying e-resource. We extend special thanks to the multiple stakeholders across Canada who have provided and continue to provide their feedback and expertise. And we are particularly grateful to the patient advocates and committee members representing persons with lived experience of vector-borne infectious diseases who've offered their time and expertise to inform this project, as well as those who shared their expertise during the gender and Indigenous consultations. CASN gratefully acknowledges the guidance and oversight of the Canadian Indigenous Nurses Association in planning and implementing the Indigenous consultations for this project. This project has been supported by the Public Health Agency of Canada's Infectious Disease and Climate Change Fund, which addresses the impact of climate change on human health in Canada. So now I'm just going to provide a brief overview of our project. The project title, as Ruth already spoke about, is called Empowering the Next Generation of Healthcare Professionals with Knowledge, Skills, Tools, and Supports to Address Infectious Diseases Related to Climate Change in Canada. In August 2018, the Canadian Association of Schools of Nursing received funding from PHAC to conduct a project with this title, and that's what we will be discussing today. The ultimate goal of this project is to increase the knowledge of the effects of climate-driven vector-borne infectious diseases on population health in Canada amongst nurse educators and to foster the integration of this knowledge into Canadian nursing education programs. The target audience for this project, the primary audience are schools of nursing in Canada, and our secondary audience are other healthcare professionals such as registered nurses, practical nurses, nurse practitioners, nursing organizations at different levels in Canada, physicians, physician assistants, medical laboratory and diagnostic imaging personnel, and so on. To achieve the project goal, the following activities were carried out. The first one was the development of national evidence-informed consensus-based guidelines for nursing education to build nursing knowledge and capacity to engage in public health activities related to infectious diseases transmitted by insects and ticks that are emerging and are expanding in Canada as a result of climate change. And as Ruth already mentioned, these guidelines have been completed and are available on the CASN website. And currently, we are working on the creation of an e-resource to facilitate and foster the integration of health effects of climate change and infectious diseases in schools of nursing across Canada. The Climate-Driven Infectious Disease Committee are a group of dedicated individuals and experts in climate-driven infectious disease and nursing. And they have developed the domains and learning outcomes, which are included in the guidelines for undergraduate nursing education on climate-driven vector-borne diseases document. And there was a representation from multiple stakeholders, including the schools of nursing across Canada, the Canadian Nurses Association, the Canadian Indigenous Nurses Association, the Community Health Nurses of Canada, various public health units, medical officers of health, the Association of Medical Microbiology and Infectious Diseases Canada, the Public Health Agency of Canada, and CASN. And this slide is a continuation of the committee members. So as Ruth mentioned, the guidelines for undergraduate nursing education on climate-driven vector-borne diseases publication is currently available on the CASN website. The document is organized into 5 domains. So starting with public health, vector-borne infectious diseases. Domain 2 includes populations exposed to potential risks. Domain 3 includes prevention. Domain 4 deals with treatment, and domain 5 is on advocacy. And detailed learning outcomes accompany each domain, and there are 34 learning outcomes in total. And the learning outcomes identified in this document provide targets for graduates of baccalaureate nursing programs to achieve in the area of climate-driven vector-borne infectious diseases. This is a snapshot of the e-resource site, which will soon be launched. So this will be available on the CASN website, and this is where you would go to take a look at what's been created in terms of modules, other resources, and additional information. As Ruth already introduced us, we are a number of the members of the Climate-Driven Infectious Diseases e-resource development team. So Michael Foley, who's the web designer, and then June Kaminsky and Andrea Harvey are also members of the e-resource development team. The e-resource is an open access online teaching tool designed as a toolkit to support current and future nurses. Its goal is to address content related to knowledge and skills needed to work with individual clients, communities, and populations facing climate-driven infectious disease. So now I'm going to hand it over to Michael, who will be speaking more to the web development piece of the modules.
Thanks, Shannon. I was brought in to work on this project. I had worked on a few different projects with CASN. And when I was initially brought into this project, I had absolutely no background in vector-borne diseases. So it's been a fascinating project for me to work on. When we sat down at the very beginning to start discussing the project, there were a number of things that we wanted to emphasize in the methodology of building out the e-resource. The first one was to identify a target audience, and it's a pretty broad target audience that is out there. It's students, it's educators, and additional audiences. The difficulty is engaging these target audiences. And so what we determined was the best way to do this is through an edutainment method, and that is the content itself. It educates while it entertains, and it allows the person who's going through the content to actually retain the information that they are reviewing. Basically, we decided we wanted to create scenarios where nursing students, practitioners, educators could see themselves in, and by doing so, we can actually create this content in smaller chunks. As everybody knows, nobody likes to read long paragraphs of text online. So it was very important that we basically brought the content into smaller chunks, into bulleted lists, into discoverable, clickable objects on screen to allow the user to move along at their own pace and their own speed. So the first thing we wanted to do was we wanted to establish a learning outcome. And so at the beginning of each one of the modules that we built, we actually have a learning outcome for each one of the lessons. And then using those learning outcomes, we wanted to introduce these relatable scenarios where the audience would be taken through them. And as you can see as an example on this screen, we have a registered nurse who is basically working with a patient who is suffering not only from the effects of a vector-borne disease, but also some underlying conditions, and going through the process of discovering how this person actually contracted the vector-borne disease. Within the module itself, we wanted to allow the user to discover information on their own. So we wanted to create a more visual format. And so you can see here the examples that we provided. There is photographs, which are clickable, that you can discover content, as well as infographics, such as the one of the sick child on the screen. It just provides just a more visual method of getting the point across for each one of the chunks of information that we wanted to stress. Once we actually went through that, we would then close each one of the modules with some thinking objectives or some thought exercises. Each one of them would basically reiterate the content that they learned during the module. And then we would have a small little quiz at the end of the module that would allow them to answer questions based on the content. So it's essentially introduce the objectives, teach, and then reiterate the content so that that the lesson itself can be retained by the user, by the student, the educator, so on and so forth. As Shannon said, we're creating a website that goes along with each one of these modules. There's additional content that's going to be available. There's a glossary, there's a resources area. And we're building these exercises in a way that you can actually use them within a course curriculum for students to introduce them to these concepts. There'll be downloadable packages where you can download all 5 modules, or you can download modules independently and use them within your own courseware. And they can be uploaded into any LMS. There's, I won't go too technical, but there's some compliancy with these learning management systems that is built into the modules themselves. And at any time, you'll be able to contact us through the website if you have questions about using these modules as well. And with that, I'm going to turn it back over to Shannon and Mark.
Perfect. Thanks, Michael. So I'm going to talk a little bit more specifically about some of the content that's included in the modules, as well as the teaching and learning strategies that we integrated. So first, I'm going to talk about the principles that guided the development of the modules. So first, we understood the need for interprofessional and intersectoral collaboration to address what is a pretty complex issue in the prevention of vector-borne diseases. Second, we recognized the importance of sensitive language and behavior that does consider the beliefs of individuals and communities about climate-related health effects. And we also wanted to respectfully acknowledge Indigenous people and their respective territories and demonstrate an understanding of their cultural strengths, as well as the knowledge of systemic, historical, and contemporary traumas that are unique to Indigenous people. And all that information is crucial to working alongside Indigenous communities. And lastly, we want to recognize that there are multiple ways of knowing. So as Shannon has said, the e-resource is organized into 5 modules to address the learning outcomes in the guidelines for undergraduate nursing education on climate-driven vector-borne diseases. So each module represents one of the guideline domains, with domain 2, which are populations at risk, and domain 3, primary and secondary prevention, being combined into one module. And we also open with an introductory module that has an overview of climate change, and that really sets the stage for the other modules. So the 5 modules are really dynamic and user-friendly. They do utilize a standardized structure, as Michael talked about, and they do integrate dynamic learning tools such as case studies, self-assessment quizzes, and virtual patient scenarios. And the estimated time to complete each module is about 2 to 3 hours. So this is the standardized structure used in each module, and I'm just going to briefly go through each of those key structures. So this is the title page for Module 1, and Module 1 focuses on the importance of eco-literacy to the practice of nursing and the science behind climate change and the anticipated changes to climate both nationally and globally throughout the remainder of the 21st century. So this module also highlights traditional knowledge to inform a sustainable approach. And we also see how this module explores the impact of climate change on vector-borne diseases, which again sets the stage for the remaining modules. And the module concludes with a look at specific actions nurses can take in respect to climate change. So following the introduction of the module, we can see how Module 1 is subdivided into 4 lesson plans, and you can get an idea of some of the concepts that are covered in each lesson. So Lesson 1 explains the ecological determinants of health. We see climate change and the greenhouse effect. and how human activity has driven climate change, so specific drivers. And lastly, we introduce the concept of sustainability. Each lesson includes specific learning outcomes. The purpose of those learning outcomes is really just to alert the student as to the knowledge, skill, or attitude they should gain through completing each lesson. So this is the example from lesson 1 in module 1. Additionally, I think one of the most fun parts of these modules is that each module highlights 1 or 2 nurses and the people and communities they work with to explore the content around climate change and vector-borne diseases, and specifically drawing attention to that role of the nurse. So to help us in our learning journey, module 1 introduces us to Grace, who is a primary care nurse. And through module 1, we see how Grace starts to hear some things about climate change and vector-borne diseases in her community. And we get to see her professional growth and how she integrates evidence-based knowledge into her nursing practice. To give you an idea of how the modules actually look, I'm just actually going to go into module 1. And hopefully, I've got a rural internet connection, so hopefully this will come up here. Okay. So here we're talking about the anthropogenic, the human-driven causes of climate change. So we can see the 4 different factors here: economic development, resource depletion, environmental degradation, and demographic transition. And we can click on each of these for a little bit more information on how they have driven climate change. We can see how we can navigate to the next slide here. On this slide, we see current global indicators of climate change. So we can look to see where these indicators have happened geographically. So these are some examples of where increased polar ice melts have happened. We see where, so the black icon there just highlights where tropical storms and hurricanes have happened, heavy precipitation and floods. So when we're done interacting with this content, moving on to the next slide, we can see how we've integrated some video content into the modules. These videos talk about projected climate changes. So how might climate change look like at the end of the 21st century? And lastly, this is the last slide that I'll just show. We have some, this slide indicates current Canadian climate change indicators. So by province, so we can look at each province and see some of the climate change indicators that we're likely to see. So we can just click through province by province. So hopefully that gives you an idea of kind of how the modules look and how interactive they are. In addition to all that interactive content, we have included critical thinking moments throughout the modules. So really the purpose of those critical thinking moments is to help students connect the content they're learning to their nursing practice, but also to the broader social and political context. So in addition to students, encouraging students to reflect on these questions on their own, we also think that these questions could be used in other ways depending on the needs of the program that integrates them. So these questions could be used as the basis of other assignments, such as reflective activities or papers, and they can also be used as a part of group discussions during synchronous learning. So there are many instances throughout the modules where students are prompted to browse additional resources. That just helps them gain a deeper understanding of the topics that are covered in the module. And each lesson and module ends with a summary slide that highlights the main take home. So from lesson 1 in module 1, we see how Grace now has a better understanding of climate change. She's more prepared to recognize the changes that might occur, such as extreme temperatures and weather. At the end of each module, there are 3 to 5 self-assessment questions that students will get feedback on based on their answers. So explanatory feedback will be provided when the learner chooses a response, and that just helps to reinforce their learning. So you can see in the video here just how students might interact with those self-assessments. So those questions are meant to allow learners to monitor their own learning and also to apply the content that's raised through the case studies and the scenarios. So In the next section, I'm just going to talk briefly about the feedback that we have received on the modules. So we did engage with a diverse group of representatives from multiple sectors. The initial content for the modules was reviewed by content experts in the spring of 2020. And we also received feedback from a broad range of stakeholders during the summer of 2020. And the e-resource and the modules were reviewed again by stakeholders throughout the fall of 2020. And so we really valued all the feedback that we received, and we paid specific attention to gender, Indigenous perspectives, and those with lived experiences. And we took a consensus approach among the content developers and with CASN about the feedback we received, and we made extensive revisions after each round of feedback. Additionally, CASN will be integrating a feedback mechanism on the e-resource website with the goal of gaining further understanding of how educators and learners are finding this product. The feedback shared by those who use this resource will be used for future updating and also to inform the development of future knowledge products CASN creates. And we really do feel that all the feedback that we received has really strengthened these modules. So the last section, I'm going to talk about how you might consider using this e-resource in your nursing program. So I do think one of the strengths of this module, of the modules, is that they do align with current competency and guidelines. So first, the entry to practice public health nursing competencies for undergraduate nursing education. Many of those domains are highlighted, including the domains population and community health assessments and analysis, as well as the domain on partnership, collaboration, and advocacy. Are you guys still hearing me? Yeah, okay.
Yeah, we can.
Okay, I was just got a message saying my connection was unstable. The e-resource also aligns with the NCLEX test plan in sections related to advocacy and health promotion and maintenance. And lastly, we all know that climate change is a threat to the health of Canadians. So academics and other nurse leaders have called on nursing education to integrate climate change curriculum to support nurses in addressing the adverse health impacts of climate change and also playing a role in climate change policy response. The Canadian Nurses Association and CASN have recognized the importance of integrating climate change and sustainability curriculum within the Canadian schools of nursing. So the last part here, I just want to talk about how the teaching and learning strategies you could use to integrate these modules, with each of the 5 modules taking about 2 to 3 hours to complete. We do understand that that's a significant time commitment needed to complete all the modules. However, we do feel like there's a great deal of flexibility in how those modules can be used. So each module is standalone, and therefore it's not a requirement that students complete all the modules or that you complete them in any particular order. We do think that the modules also align well with many nursing courses, including courses around community health and global health, really any course that has a focus on environmental risks, prevention, health promotion. So I think within those nursing courses, these modules are a good fit. Additionally, the COVID-19 pandemic has prompted many nurse educators, including those in our program, to shift away from traditional face-to-face learning, at least for now. So if you're like our program, you may have integrated strategies such as the flipped classroom, where students are introduced to content at home, and then that learning is reinforced and expanded on during synchronous sessions. So kind of the opposite of traditionally like lecture and then homework. So one way a flipped classroom approach could be used is for students to do the module work independently, and then for educators to use the critical questions that are found throughout the modules in synchronous sessions. So educators could use strategies such as small and large group discussions or world cafes or breakout rooms in Zoom to explore those critical questions, because they really do encourage students to make connections between the content to broader issues and concepts like the social determinants of health and public policy. And then lastly, I'd like to give you an example of how these modules might be integrated into your curriculum across multiple courses, using the example of our program at the University of Lethbridge. So in our third year of our program, students will take a theoretical course on health promotion, and at the same time, they'll also participate in their community health clinical and take a course on leadership. So we see the potential for the modules to be integrated across all three of those courses. So with the modules on climate change and vector-borne diseases being integrated theoretically into our health promotion course, while the practical component of things like environmental scans, community risk assessments, and prevention and promotion planning being integrated into our clinical course. And then lastly, we see the modules related to climate change and vector-borne disease advocacy would be a great fit with our leadership course. So you can see how there's the potential to use the modules in multiple different nursing courses. So we began this project in January of 2020, and we're getting pretty close to the end. So we've been finalizing the content throughout the fall of 2020 and this winter. And we are working on, or CASN is working on translating and testing the e-resource. And the official launch is planned for spring 2020. So we encourage you to visit the CASN website over the course of the next few months for updates and to get access to that new e-resource, which will be available in both English and French. So that is our presentation. I just wanted to open it up to any questions or comments, and I'm going to pass things off to Ruth.
Thanks, Shannon, Morgan, and Michael. That was very helpful, very informative. So feel free to either put your question in the chat box or unmute and ask your question. So I do see some have, how often, I'm just, there's a question that has come through in the chat. How often will it be reviewed for updates? And maybe that's something Julia could comment on from CASN. Oh,
yes,
good.
hi, that's a good question. Typically, CASN conducts reviews every 5 years. So in order to do that, we start the process even sooner than that. We'll start 4 years in and begin to put together the panel or committees or experts that would look at our e-resource in this instance. We are collecting, we are going to be integrating a feedback mechanism onto the e-resource, I should also mention. So that will allow learners and educators to give us their input, let us know what's working, what's not working, if there's anything missing. And so that data will be collected over the short and long term and will be used as well for our updating process.
Thanks, Julia. That's helpful. Well, we'd like to ask you a few questions, so feel free to respond. It will really be helpful because, as has been mentioned, these webinars are all about knowledge translation. So we're really keen to get this new resource out to you and others. So we'd really like to hear from you. So the first question is, what do you think are facilitators to support the use of this e-resource in your curriculum? From your perspective, what would facilitate its use? So just feel free to unmute or you can comment. But okay, Wanda, sure, go ahead, Wanda.
Sure. So thanks for this and all this work. It's really exciting to see. And so I teach community health, but I think the way that Morgan has described it is being put in across different courses. I was a little concerned about the amount of time for the whole piece. So I think you've done a lot to already facilitate that. And I will certainly, and I know Marie is here as well, it'll certainly be encouraging other courses within our curriculum to include it. But yeah, this has been a great introduction.
Great, thanks, Wanda. Any other comments in terms of what would facilitate the integration into the curriculum? While you're thinking about that, there has been some questions in the chat about whether there's a certificate or badge, whatever, for students to, once they complete it, that there's evidence that they have completed it. Is there a plan for that? So maybe one of the, either Shannon, Morgan, or Michael could respond to that.
Oh, go ahead, Michael. I'll let you.
Well, it's absolutely something that can be offered for sure. At this time, there's no badge or certificate. I'm not sure what you were going to.
Okay, thank you for just clarifying. But I think what it's helpful to hear that it's a possibility. But I think what that is a consideration that we might more consider. So thanks for mentioning that, because it would certainly be helpful for students moving forward in perhaps a future job role or whatever that they apply for, that there's evidence of various certificates they've achieved. Good. Now there is another question here, also just to recognize what's there as well, is for people who have had Lyme disease experience and the neurological problems. And we recognize, as you'll see, a number of implications that people experience as a result of it. And so there's multiple, we have, as you will see, neurology is one area, having a neurologist involved. But the question is, is there a list of physicians? At this point, I don't think we've given that detail. We have recognized that, as I mentioned, a number of healthcare specialties can be involved in caring for people with Lyme disease. And that's a learning that we gain through this experience in the development of the guidelines and this resource. But we don't give specific information like that. And that would be something perhaps students could consider as they're learning this, that what would you say if you had that question asked, and help the students think through how they might do that. So that could be a learning experience for students to explore. Who would be the specialists involved in that? So just a response, and whether Morgan or Shannon wanted to respond any further to that, feel free to do that.
Yeah, thanks. So no, the short answer is no, we haven't compiled a list of neurologists. I think that's partly because it'd be very hard to keep that up to date, but we have linked throughout the modules to a lot of different Lyme advocacy groups that and patient support groups that would be able to help patients kind of navigate the healthcare system there. So I think we have provided them with the right starting point.
Thanks, Morgan, for responding. We have another question in terms of how can one access these resources? And maybe you could clarify what you meant by what resources you're referring to. If somebody could say, what resources? Did you mean the e-resource or some of the resources that Morgan just mentioned? If somebody could respond, that would be helpful. This is not, at this point, the e-resource, so I can respond to that. At this point, the e-resource is not on the website, but it will be on the website of CASN. We're going through the process, and as Shannon and Morgan alluded to, the release of this will be after March. Is that fair to say, Julia? I think the timeline, as you saw, will be coming at that time. So it's not on the website now, but it will be. So any other, perhaps maybe moving to another question, what could be some potential barriers that you may face in using this e-resource? If you could, anybody want to comment on that? If you're, obviously this is all important because we want to make sure that this is user-friendly and it's being integrated into curriculum, but it's really helpful to know what there could be some barriers, because those are the things that we need to look at, really some strategies in addressing them. I think one has come forward. I can go by the chat. Will there be a cost to universities who want to use this content? And no, there's no cost. It is accessible on the CASN website, as are many other resources that CASN offers to schools of nursing across Canada. And it's not only open to schools of nursing, it is open, as you can see, the audience that Shannon nicely outlined goes well beyond just nurse educators, nurses in practice, other disciplines, community members, whoever. It's pretty open. So there's no limitations there. Any other potential barriers anybody might see or comments related to that? Good questions.
Ruth, I just wanted to add, even just to the earlier question and comment, that CASN will, in addition to, like, we'll be launching in the spring, as you mentioned, and it will be available on the CASN site. And if you subscribe to the CASN newsletter, you'll definitely get an alert. Otherwise, if you visit our homepage, you'll see it on our homepage when it's live. And anyone that's registered to any of the webinars in this series will also receive an email notification, as you've clearly expressed interest in the project.
Thanks, Julia, for adding that. Good. Any other comments anybody has about either potential ideas, how it could be integrated, or areas that maybe would be helpful to potential barriers you feel that may be hindering you from using it within curriculum? Okay, so maybe we can actually think of some ways. How do you think you could use this in terms of, like, obviously the one question was the cost. So if that's not a barrier, which is great to hear. How do you see that you could use it in your curriculum? Just to pick up on Morgan's ideas, that would be really helpful to know how you think it could be integrated. Any ideas?
Sure, I'll talk.
Awesome, way to go, Wanda.
I think my biggest concern is about whether if some of our faculty take it up in second year and in third year, like where making sure across the curriculum that we know where it's been used and what modules have been used. That would be one of my biggest challenges. But I mean, I do a climate change class in my community health course. So I would take particularly that first module and have the students work through that for sure. So yeah, I'll be interested to sort of see. I think I will need time to go through it myself and then see where it would fit, and then talk to other faculty about how they could, like, where they could also use it.
That sounds great, Wanda. A good suggestion that to respond to your question was, how would you ensure that there isn't duplication in the curriculum across the years, and how do you coordinate that? And that sounds like, talking to other faculty who you potentially may integrate into the curriculum could be a great way to coordinate it within schools of nursing. Are there any other suggestions others have about the idea of not having it repeat itself within the curriculum? Anybody got other suggestions how you would do that?
Ruth, I can kind of jump in though. Michael's probably better at talking about this than I am, but because because you can download them and upload them into your learning management system, there should be that can, I think, help to ensure that there's not duplication across courses, because each module is downloaded, you can download it independently. So I think that's one way that you can ensure that students courses in different years.
That's helpful to know, Morgan. Thanks for sharing that, because and the students obviously will know if they've done it before. But I think what you're saying is the system will recognize that. We also have, so thanks for that, Morgan. We have another question that has caught, that probably is kind of reinforcing the idea of a badge or a certificate, is that there might be more buy-in for students, because there is a concern for time. And the length of time to do each module. And I think the comment, which is a very valid comment, is if the students have a certificate, then it might give them credence for spending that time if they have that outcome. So again, that's just reinforcing it. So it gives them incentive, is what I'm saying.
Ruth, if I can
Yes.
interject,
Sure.
if you download the packages and actually include them in your university learning management system, there's also ways to track progress and offer badges and things like that too. So you may want to check in with your university learning management team to see if that can be done, because you can actually just take the packages as is and create a program out of it too.
Great. Thanks, Michael. I appreciate that. Here's another question I think would be important to talk about is, let me see. Does the content address only a Canadian perspective situation, or is there other countries considered? So maybe Morgan or Shannon could respond to that, because you did allude to the nature of courses, i.e. community and global health courses, which I think does give that a little broadness, but I think you could probably nicely help us elaborate on that.
Sure. The content is primarily focused on Canada, but we do spend quite a bit of time in the modules talking about emerging threats as well. So what are some of these vector-borne diseases, for instance, in the United States that are a threat to Canada? We talk about some exotic vector-borne diseases. So things we normally don't see in Canada, but can be a threat with climate change. So things like malaria, and then talking about travel and vector-borne diseases as well. So how does that change the situation, right? If we're looking at a diagnosis, has that person recently traveled? So we do try to bring some of that in, but in terms of the focus on, what are some of the threats in Canada, that's where the content is centered, but we do bring in some of those other pieces into the modules.
Great. Thanks a lot, Shannon. Appreciate that. I hope that was useful. And we've had a response, which I think is an important thing to recognize, to pick up on Wanda's comment about how do you monitor where in the curriculum. And the suggestion has been, obviously, in some schools of nursing, there's usually you will see a curriculum review committee who will have that overseeing tracking of the content of curriculum across the years. So that is something perhaps if you do, and many schools of nursing do have that within their structure, would be a mechanism to really ensure that there wasn't that redundancy across the curriculum. So thanks for mentioning that, because it is certainly a part of the mapping that does happen, that curriculums need to do within accreditation or within your regulatory body requirements for program evaluation. Good comments, wonderful comments. Any other ideas? Sounds like people are seeing that this is an option in exploring and integrating into the curriculum just from comments. Any other comments others have and how you could use it? Feel free to comment in the chat box or unmute and share your thoughts. Great ideas coming forward and great comments. Wonderful. So maybe I did see that we had, just to recognize, which you probably everybody's seen the chats, but it's good to see that we've got some independent nursing nurses in independent practice is what I'm trying to say. And that's a group that we hadn't considered, but I think a very important group too to recognize. So you can see how it's being broadly applied to nurses in all practice areas, because it is such an important area of topic that we are going to face no matter what area of nursing that we're in. So great. Any other last minute comments from the audience or from our speakers that you wish to say?
Ruth, there were some, I think, comments just kind of speaking towards some of the challenges with the diagnostic and treatment of Lyme disease. So
if you'd like to respond to that, sure, go ahead.
Oh, yeah, sure. So we did spend quite a bit of time and really valued a lot of the feedback that we received from the Lyme disease patient advocates. And we do recognize that and the modules recognize that there's a lot of complexity around receiving adequate diagnostics and receiving treatment for Lyme disease. So we do discuss some of the challenges around diagnostics in Canada and some of the push and pull factors related to, some Canadians feeling that they wanted to receive care either outside of the conventional healthcare system or outside of Canada. So we do discuss some of those challenges within the modules. So I think it will allow, or it does give students, some perspective on really some of the challenges that people diagnosed or seeking diagnosis of Lyme disease face.
Thanks, Morgan, for noticing that. Sorry about that. For the person who posted it, sorry, I missed that. Great, good, very important, because those are some of the details that all of us kind of learned, and we've had a very strong working relationship with the patient advocate groups who have been involved right across the development and throughout this whole project. So they have really given us some insight, and that has been informed. Good. And I think I see one other comment that these modules will certainly be useful for nurse practitioners as well. Good. Any other last minute comments from our speakers or anybody else? Great. Well, thank you. We've got several commenting on thank you. So we really trust this will be something that will be useful to you. Your ideas have been very good that you've brought forward. I think the idea of a certificate sounds feasible, certainly from a student perspective, as a buy-in and incentive for doing it, given the time it may take to do, and how we can integrate it across the curriculums. And of course, this is just the first module. There will be webinars for all, another 4 webinars, I believe, has been planned. So keep track of when the dates are, and we hope that you will join us for the other 4 webinars, because they will, likewise, you'll have an opportunity to get a sense of some of the content that are covered within those 4. Shannon and Morgan nicely highlighted some of the content within this first module, so you'll get a sense of each of the modules, which will be helpful in terms of your decision and their use. Sorry, I see some questions coming through. Will you think of getting this course accredited through CNA? That's a good one. That's a good one if we can get it accredited through CNA. Thank you for suggesting that. I guess we'll have to look into that, eh, Julia? That's a new one, but certainly we need to. That is new. So it is, thank you for suggesting that, whoever suggested it. So, oh yeah, Gigi, of course it was. So anyway, that's wonderful. So we're so glad that you joined us today. And this again, thank you to Shannon, Morgan, and Michael, and all of those who have participated. Please note the recording of this session will be available on the CASN YouTube channel and circulated to you in the coming days. Because you were part of the webinar, you will get it. Please feel free to share the link broadly with your network. And thank you again, everyone. And CASN certainly hopes you will consider attending, as I mentioned, the other upcoming sessions And so please visit CASN, and you will see that under CASN Climate Change Nursing Webinars, and it'll be listed in there for more information and for you to register. CASN will be sending you also, as was mentioned at the very beginning, a feedback survey in the coming days to hear your feedback about each of the webinars about this e-resource. And please look out for this email sent to you directly. And thank you again for your participation. Have a wonderful day. Bye now.